Hello, my name is Brian Smith. If you're a strategist in the life sciences industry, then this seminar is meant for you. You can watch it as a YouTube video or you can listen to it as a podcast. And if you want your company article, then just request it from my site. The details are in the notes below. I've worked in, researched, written about this industry for over 40 years now. And my aim is to tell you something that is relevant and useful to you, but that you've not heard before. If you think I've managed to achieve that, then please like, subscribe and share this podcast with your colleagues. And if you want to know more about my research, then get in touch and we can have a virtual coffee. The life sciences industry is a complex adaptive ecosystem. And like any such ecosystem, we can't easily predict its future, not with any precision anyway. But that doesn't mean that we're blind to the future of the industry, because we can use the industry's history to point out what future might emerge. And the long-term consequences of COVID are a very good example of how we might do this. Let me try to explain. It's often said that history doesn't repeat itself, but it rhymes. In other words, the future probably won't duplicate the past exactly, but it might echo some of its broad patterns. Now, one of the most important events in the history of the life science industry was the discovery and development of antibiotics. As well as saving millions of lives, antibiotics changed the structure of the industry. You see, up until the 1940s, the US had been a follower in the pharmaceutical industry, which was dominated by Germany and Switzerland. The US pharmaceutical was, broadly speaking, fragmented, small scale and quite low margin. But when the wartime allies needed new biotics in vast quantities, they selected a few companies and forced them to cooperate in what was known as the Penicillin Collaborative. Not only did this accelerate research and development and scale up, it also made those few companies very, very successful. It taught them new ways to bring new drugs to market and then rewarded them with exceptionally large cash flows and profits. And these pots of cash were used to exploit what became known as the therapeutic revolution of the post-war period. This in turn shaped the way that the industry was structured in a way that's still mostly recognisable today. The point of my story isn't to teach you history, it's to point to the future. The COVID epidemic has been compared to a wartime situation by many people. mRNA vaccines have been compared to the miracle of antibiotics. But the most interesting line with history is not the science, but the politics and the economics. You see, in 1920, just like in the 1940s, government intervention strongly directed the industry, and a few companies, particularly Pfizer, BioNTech and Moderna, they got lucky. And they now find themselves with new capabilities and mountains of cash that they couldn't have predicted even a few years ago. And now we're beginning to see that influence the future of our industry. Pfizer, who are forecasting about $26 billion in additional COVID revenue, are spending money on everything from scale-up facilities to oral COVID drugs. BioNTech looks like it's going to use its profits to boost its original mission, which was in oncology. And Moderna is using its cash to try to become a leader in the RNA vaccine space. Now, this isn't a direct repeat of the 1940s, but it is a very strong rhyme. Because history only rhymes and doesn't repeat exactly, we can't see what the consequences of COVID will be for industry's long-term structure. They may not be of the same scale as the antibiotic transformation that our parents and our grandparents saw, but we should anticipate some rhymes with the 1940s. Then, as now, a few companies are cash-rich at a time when science is creating just the opportunities to be exploited by a pile of cash. That shaped the industry then, and we should expect to see something similar now. Watch this space. Thanks for joining my seminar. If you found it worth your time, please like, subscribe and share with your colleagues. If you'd like to read my article about the long-term consequences of COVID for the industry, then please go through my website and you can request a copy there. The same goes if you'd like to browse any of the 300 articles, papers and books I've written about our industry. And if you'd like to know how my research can directly help you improve your competitive capabilities, then just get in touch and we can set up a virtual coffee. I'd love to hear from you.